Thank you very much for staying on the program. Government and hospital pharmacists have today called a strike. National Chairman for Government and Hospital Pharmacists, Stephen Kwakwe, says from all OPD services, night and weekend, have been withdrawn. The pharmacist insists only emergency services will be attended to.
I got here at 6 a.m. and we've been told.
We'll bring you that soundbite in a bit. But let's talk about the doctor's strike. And at the Kolebu Teaching Hospital here in Accra, patients are continuing to feel the impact of the partial withdrawal of services by doctors at public hospitals. Hannah Odame, who visited the hospital on Monday, reports patients are having to wait very long hours in their quest to seek medical attention.
Doctors are not on duty, and yet we have to wait till further notice. So we are still here waiting.
But it's past 10, so if you've been told the doctors are not working, why are you still here? Why don't you go to another facility where you'll be taken care of?
Because we've been told there is a possibility they will come and work. We are here on a referral, so there's no other place that we can go.
How long are you willing to wait? Because you waited 4 hours already.
I'll wait till noon 12, then I'll leave. Yes.
How does this make you feel? I mean, sitting here for long hours just waiting for a doctor whom you do not know whether will come or not.
It's very, very frustrating because I'm supposed to be at work. I just took permission. So me not being able to see the doctor today is going to be a huge problem because it will be very difficult for me to get another permission to come here again.
Maybe 7 o'clock.
I got here at 7 a.m. and was told the doctors were on strike, but I have put my folder down waiting till 11 a.m. If no one tells me anything, I will go home. I was transferred from the children's hospital, so I don't have anywhere else to go.
You won't transfer me. Me, I'm transferring for children's hospital at the back.
The story of Grace is different. For her child is on admission, and so we want to find out if indeed the promise by the doctors that they will take care of patients on admission is being carried through. Grace, is your child being taken care of by the doctors?
My son was brought here as an emergency case, but no doctor has attended to him since last Friday. The nurses only give him food, but no doctor has seen him or prescribed medication for him. The nurses cannot tell me when a doctor will come and take care of my son. I am so worried.
So as we just heard, the story of Grace is totally different. The Ghana Medical Association told us that they will take care of patients on admission, but as we just heard from her, even those on admission, that's her son in particular, has not been attended to since she brought the child here.
Well, that also means that patients would have to find alternative healthcare facilities to be able to see to their healthcare needs. And because of that, the police hospital says more patients are trooping to their facility for healthcare since last week. The hospital's outpatient department, for instance, say, they say they saw larger numbers over the weekend. Patients have had to resort to the police and 37 military hospitals because of a doctor's strike. Authorities at the police hospital say they have put some measures in place as they anticipated the numbers.
The police hospital and the 37 military hospitals in Accra are the only public hospitals whose doctors are not on strike. The police hospital recorded about 450 cases at its outpatient department over the weekend, a significant increase over the usual 250 cases recorded prior to the doctor's strike. As at 3 p.m. on Monday, about 200 patients had accessed health care at the police hospital. Most of the patients who showed up at the police hospital expressed frustration about being turned away from other public facilities and pleaded with government and the GMA to settle their differences.
I went to the General Hospital, but I was turned away. I got there at 7 a.m. But it was until around 2 p.m. that someone advised me to go to the police hospital.
I took my son to Lekma, but we were told doctors are on strike, so they didn't take care of him. I felt very, very bad because my son was suffering. I'm pleading with the doctors and government to resolve their issues now.
Acting Public Relations Officer at the police hospital, Corporal Faustina Nunekpepu, says the hospital has put in place contingency measures to meet the needs of patients who may access the facility as a result of the strike.
We are putting plans underway to procure more drugs and consumables to help us take care of clients who will come here. And also we are looking at erecting tents on the hospital's premises to serve as temporal wards, because the hospital has a bed capacity of 100, and out of this 100, 70 is for the adults and then 30 for children. Yeah, so we have a challenge when it comes to space. Again, we are also looking at the corridors that we deem so appropriate. We are looking at getting them finished with beds, mattresses, and then curtains.
As part of the measures to manage the situation, the police hospital has recalled all staff on leave and has placed a temporary freeze on leave requests until the doctor's strike is over.
Meanwhile, government has described the strike by the Ghana Medical Association as illegal and is therefore asking the doctors to call it off. In a statement released by the Employment and Labour Relations Minister Haruna, government is committed to creating a conducive working condition for all public sector workers. It further said, government has been in discussion with the GMA on conditions of service for medical doctors. The statement adds, there is the need to maintain equity in public sector remuneration, especially in order not to jeopardize the recently implemented single spine pay policy. Haruna Idrisu has been speaking to our sister station, Joy FM, on this issue.
The action of the doctors is clearly unlawful, it's illegal. We cannot, as a government, be compelled to negotiate under a cohesive environment or under duress. So I expect that we will respect each other as parties to the negotiations. Therefore, mine is to appeal to them to return back to work while the negotiation process continues. We are doing this within the constraints of the national budget, and accordingly, we have referred the financial implications, the Fair Wages and Salaries Commission, and the Compensation Department of the Ministry of Finance to analyze in order that government can meet them with an informed position as to what is possible within the constraints of the budget and what is not possible. We just got out of the problem with junior doctors. We've asked the Ministry of Health to deal with nurses who are now being processed onto the payroll to avoid they taking a similar action.
Now, government and hospital pharmacists have today called a strike. National Chairman for Government and Hospital Pharmacists, Stephen Korkwe, says from OPD services for night and weekend have also been called off. The pharmacists insist only emergency services will be attended to.
We have come from, 4 years of very painful negotiations, agitations and arbitrations and discussions. They have decided that with effect from today, 3rd of August, we're going to withdraw all OPD services, night services, weekend services. We only attend to inpatients and emergency services from today. The concern was seeing the migration of the pharmacists onto the single span. We have had issues with the placement of the pharmacists on the grade structure. We had gone to the National Labour Commission, had a compulsory arbitration, then later on had a ruling by the National Labour Commission on 2 occasions, which Fair Wages and Salary Commission did not implement. And that led to another 2 strikes. The issue about the interim market premium, which was a proxy as a result of the extra duty hours that we were doing before we were moved on to the single span. To tell you the truth, the pharmacist group were the only group that after the migration of the single span, they were in negative salary. That is to say, their health service work salary structure was far, far more than the single spine pay policy.
Away from the health sector, Northern Regional Director of the Ghana Education Service, Alhaji Mohammed Haruna, says the lack of discipline in senior high schools would hamper education if not urgently addressed. Over the last week alone, there have been violent student riots in 4 secondary schools in the Northern region. This resulted in the death of 1 person. Alhaji Haruna is worried that indiscipline is becoming a norm among students.
Flimsy excuses are used by the students to go on demonstration, and that's what I'm trying to bring out. That's just one. In the case of Salga, I've gone through their grievances, and the only point I can give them a credit is where they said their student leaders are not elected by them but appointed. That is wrong on the part of the headmaster. But there are other excuses they give which are just flimsy. You could see what was happening there in Salaga, as you mentioned. Just because the staff said, do not wear slippers to the exam room, because they write foreign material, they write formulae and other answers or a certain answer on the slippers when they are going for exams, and they slip off and copy. So to avoid copying, they said they shouldn't wear slippers. In Yagaba, students feel that when they are in classes and they are tired, they can get to the dormitory and relax. And because they check them, they say they won't agree. No, I mean, do you fancy this? This is something we should not tolerate. Okay. If you tolerate this and they become the norm, the ruling, the become part of the rules of school, then education will be jeopardized.
He says school authorities should not be vilified for trying to set rebellious teenagers on the right path.
To punish students, other parents will come out, child rights activists will come out and spell out their right to do this and that, and that's what is now telling on everybody. In the case of Northern region, it looks as if they have just come from some kind of independence. They are excited over being supported by communities when they want to go wrong. I've realized that for the past 50 years, the 3 northern regions, we have been at the WASI and BEC. Either one region is 8th, the other region is 9th, and the other region is 10th. And because of this kind of performance, I think we should raise the standards of education. And therefore, I've asked the headmasters or the heads of schools to implement certain rules in order for the students to learn.
When we return here on Joy News Desk, we'll tell you how her father impregnated her own daughter and forced her to use contraceptives after delivery.